Sheila Cheptoye, and we are still with Dr. Seggane Musisi.
Talking about treatment, I'm looking at now two categories
Yes.
of mothers. So there is the pregnant woman,
Yes.
and then there is the breastfeeding mother.
Yes.
So if they are having medication or they're under medication for
Yes.
bipolar,
Yes.
would that affect them in any way? Or should
Yes.
they
Yes. We
discontinue?
know medications that will cross the placenta, as we say, and affect the baby.
Oh, okay.
We use terms like teratogenic, meaning to affect the baby. We warn mothers about that. And many of the medications that are given for prevention of relapses will affect the baby. So we take them off, but we put them on other medications which will not cross the placenta until they can safely deliver their baby.
Okay.
Yes. So that's why we prefer that every pregnant mother should see a doctor to be given advice about medications that they may be taking. Yes.
And doctor, the challenge of a mother, let's say a pregnant woman, close to giving birth, and then they have no idea that
Yes.
they have bipolar.
Yes.
Is there a possibility that they could actually harm the child in the process, especially when it becomes depressive?
Okay. There is harming the child in utero.
Yeah.
There's also harming the child after birth.
Okay.
Both we take care of them. It is possible to harm the child. It's not unknown for mothers in depression to want to harm themselves and to want to harm the baby. We call them infanticides. So those infanticide, homicide kind of things, or suicides, are not unusual. You've heard about them, I'm sure.
Totally.
You know, so we look out for it, you know, and we try to prevent it. On the other hand, there's also the enthusiasm of having had a new baby, but then going overboard in trying to look after the baby and doing harm in the process.
I see.
You know, so usually we say that if a mother has a severe mental illness at birth or in pregnancy, it's best that they come to hospital and we take care of them.
So they come to a hospital like this that
Like this.
does take care of mental health?
Yes, yes.
And
These days we teach the ability to take care of mental illnesses in every hospital.
Oh, I see.
You know, we are trying to train mental health workers to be in every hospital setting, because you cannot say that all people in Uganda should go and seek one hospital
True.
to have their treatment in. So when in medical school we give psychiatric training to all health workers, nurses, midwives, doctors, clinical officers, yes. And also there are also psychologists who help in counseling, you know, and social workers in case there have been disrupted family relations. Yes.
So many children in school or students get bipolar disorder, and then the end result is they're either suspended or something. How do we help these?
Strictly speaking, there are many mental illnesses that affect young people, especially in school. Not just bipolar. There are learning disabilities, there's epilepsy, there's psychosis, there's substance abuse, you know, alcoholism, drugs. But for bipolar disorder, it becomes very disruptive of school. Let's take the manic episode. One will not be able to sit still and be disciplined to go through a class, to listen to the lecturer, to be respectful of the teacher. They become disruptive that way. They may engage in behaviors that are not tolerated in school, including substance abuse, you know, arguments, fights,
Yes.
Irritabilities. They will not sleep well, say in boarding school at night, because bipolar affective disorder disrupts that. They'll make noise. Now, on the other hand, there's depression, which takes away your concentration and your ability to stay focused. And you won't sleep, you lose appetite, you lose energy, you lose concentration. Your grades begin to fail in school, and you may actually drop out of school. So at either end, they become very disruptive. And many students, when they have an episode, they miss out on exams. So we always say that when they're in school, they should actually stay on a medication to stabilize their mood and to prevent relapses. And also you counsel them about excesses in behavior. And you want the teachers to be able to know their students who may be in trouble with these illnesses.
Okay.
And the other thing is stigma. You know.
Exactly.
Knowing that one has a mental illness becomes stigmatized in our society.
Yes.
People laugh at them, people call them zontos, they'll name them all kinds of
Yes.
things.
I think they're incapable.
Incapable.
Yeah.
So it becomes something to hide, a secret.
Yes.
And they may have attempted suicide, or they may have a family history of it. So all of this become stigmatized. And also this misunderstanding, people thinking that these are mizimus, you know, ghosts or genies or whatever it is, demons, you know,
totally.
on them. You know, all these are examples of stigma. And these so-called alternative explanatory models of mental illness, people think this is witchcraft, you know. These kinds of things become very difficult for the youngster to deal with during their school time. But with good counseling and teacher understanding, you know, of these problems, surely they will go through school. I've treated very many young people who have been able to finish their school and become professionals.
That's right.
And they're being very helpful to society.
Indeed.
Yes.
And when you say that, I also, I'm looking at the teacher
Yes.
and the parent.
Yes.
I think these play a very big role.
Very much so.
Because if the parent, at the end of the day, if a child is expelled from a school and actually the issue is a mental challenge,
Yes.
The parent really needs to be understanding of that situation.
Yes.
And the teachers as well
Sure.
need to be really, really involved in the process.
By the way,
yeah.
bipolar disorder does not discriminate. So even teachers get it. Even parents get it. So society has to be, we call it mental health literacy. We have to educate society about mental illness.
That's right.
And to know that these are illnesses that come in people and have to be managed correctly.
That's true. And there's a tendency to say that, oh, those are Chizungu problems, you know?
Yes.
There's a lot of that.
Yes.
And that's also another form of stigmatizing people,
Yes.
because then they don't expect you to go through something
Actually,
like that.
misinformation is very important. Some people say that these are diseases of civilized Bazungu, you know, or Chizungu illnesses. Other people say, no, these are African diseases, which cannot be touched by Western medicine or by hospitals.
Yes.
All of these come, and then some people say, no, these are religious curses, God's curses, or these are witchcrafts. So there's all kinds of misunderstanding about causes of mental illness.
True.
But to summarize it, they can be biological causes, there can be psychological causes, and there can be social causes. You have to understand, for each individual, what has been the contributory factor in their illness.
True.
And how to help them.
True.
Yes.
That means that if it's hereditary, you actually need to understand your family background and
You
history.
need to understand it and to know that that does not mean a curse. No, I wear glasses because somebody gave me a gene for myopia or something like that. You know, it does not mean that I'm cursed.
Right.
Others have hypertension, high blood pressure. Others have diabetes. Others have cancer. You know, all of these things. Just a recognition that that may be a cause, it does not mean not treatment. No, recognize and treat and advise.
True. There's a tendency, I hear a lot, somebody will say, I am bipolar. Would that mean that's a personality? Is that a, what would you put that, is that even right? If somebody has bipolar, would they actually say, I am bipolar?
For us,
Yeah.
in mental health, we try not to call people diseases. So we don't say you are bipolar, we say you have bipolar illness. Just like you have malaria, you don't say I am malaria. You know?
Yes.
So it is already stigmatizing to say I'm bipolar,
That's
or I'm
right.
schizophrenic, or I'm depressive.
Yes.
No, say I have depression. It means it can be treated. You know, I have a problem with alcohol. Not I'm alcoholic.
I'm alcoholic.
You know, it can be helped.
Yes.
You know, it's not fixed. So it's a good idea to say I have bipolar disorder. I need help. I need treatment. And then you can go and have treatment. That's a healthier way of looking at it.
Sure.
A non-stigmatized way.
So the other one is a stigmatized
The other one
kind
is
of
stigmatized.
Yeah.
It is categorizing people by illness.
by illness.
You know,
Yeah.
we see it in even other illnesses, HIV/AIDS. You say I have HIV/AIDS, not I am this.
Yeah.